Gives me great pleasure to introduce our next speaker, Dr. Anuja ma'am. Dr. Anuja Singh is the principal of the Nethralaya Academy and HOD of Optometry, an alumnus of ESO and Nethralaya as well. I would like to reiterate how wonderful all our speakers have been. The minute we approached, they said, yes, what do you want us to do? Because they're so passionate about optometry as a field, and, you know, they want to really give the best of the opportunities to the students who are doing optometry. So opportunities in academics, we have a recorded talk by Anuja ma'am, and Anuja ma'am is also available online with us. So if you have any questions, I think there were a lot of questions about opportunities with regards to academics. Most of it will be answered by the talk, but if you still have queries, please post them. We'll be able to take it up. Thank you.
Good morning, my dear students, friends, and faculty members. At the outset, my sincere gratitude to Acchutha Eye Institute of Optometry for the wonderful initiative called Inspire to develop students in various domains. My sincere thanks to Dr. Bala, Mr. Saranya, Dr. Gopinath, and the entire team of Acchutha, and best wishes for their new initiative. The topic that is given to me today is opportunity in academics. Let me share my screen. This is one of my very oft-quoted and oft-repeated poems that I love, The Road Not Taken by Robert Frost. So in the last sentence, he says, I'm very fascinated about this. Two roads diverged, and I took the one that was less traveled by, and that has made all the difference. So, my dear students, it is very important to choose the right path early on in your career to set the right tone for the future. So it is a myth that if you get a college degree, it will be easier to get a job. Unfortunately, that is not the case. So employment is about eligibility and employability. So by eligibility, we mean the qualification. That is the qualification that you acquire during the course of your university program. And employability is the skill set that you acquire during the 4-year program. So only when you have both eligibility and employability, your employers are going to love you. They are going to be ready to hire you for the services that you offer. Right? So now in optometry, you have many certifications, academic certifications that can help you acquire a skill set. These programs, also known as the fellowship or residency programs, are offered by reputed institutions. The main difference between an academic certification and an educational qualification is, in a college degree, when the syllabus is framed, when you study in the first year, sometimes by the end of 4 years, the entire syllabus may become obsolete or redundant. Whereas when you acquire an academic certification, you are updated with the latest evidence-based practices. Fine? Okay. So the fellowship programs are offered under various categories like clinical optometry or comprehensive optometry. The name may vary a little bit, and you can also acquire various specialty clinical skills like contact lens, low vision care, binocular vision, vision therapy, orthoptics. pediatric optometry, ocular prosthesis, vision rehabilitation, special children's vision clinic, anterior segment fellowship or anterior segment diagnostics, posterior segment fellowship, community optometry, orthokeratology, and so on. There are also equal number of certificate programs available, which are usually in the fields listed in your slide. Digital biometry recording, electrodiagnostics training, it could be glaucoma, myopia management, sports vision, occupational optometry, orthokeratology, and so on. Now, these programs, the certificate programs, they may be online program or offline programs. You have to see what suits you and who is offering the program. It could be by the state bodies, the state associations, or it could be by national level institutions or international organizations. So you can choose accordingly. Now, your certificate programs need not be in the field of optometry alone. Suppose you want to pursue something interdisciplinary, you want to try something different. As an optometrist, you could also acquire a certification in hospital management or quality management. For example, your hospital goes for NABH certification, quality accreditation. I'm sure all of you know what is meant by quality management or NABH accreditation. So you could be a member of the quality team helping your hospital get NABH certification. You could pursue a certification in research, and that could help in a project, and you could be the member of the research team. It could be a certificate program or a postgraduate diploma in optical retail management. If your hospital is expanding, they are starting a new optical outlet, you can take an additional responsibility and provide value-added services apart from your services being an optometrist. Now, all this will enhance your reputation within the organization, and your employer is going to value you for that. Now, there are some rules of thumb when you choose an academic certification program. First is you have to check the reputation of the hospital or the institute. You have to find out whether it is a hospital or just hospital or a training hospital where some importance is given to training interns, fellows, and so on. Or is it a teaching institute? Usually, training hospitals and teaching institutes are more sensitized to the needs of a candidate who is coming to pursue such a certification program. And also look at who is the faculty, who is part of the management, what are the student engagement practices, whether there is any weekly didactics, discussion, journal club, whether these things are done on a periodical basis, whether the hospital or institute conducts CME programs. Basically, what are the engagements available for candidates pursuing such programs is something you need to look at. Also, you have to look at the fee structure, like what is the fee structure, whether are they going to pay you any stipend or you have to pay them a fee to pursue the program. This is also something you need to look at. What will be the certificate issued on completion? If possible, you can also ask them to tell them, I would like to have a look at the certificate. It's perfectly fine, perfectly legal to ask. And also whether there are any affiliations to any universities or professional bodies. What is the duration of the course? Okay, 6 months or short term is usually sometimes 3 months to 6 months, and long term certifications or for from 1 year to 18 months, up to 18 months. And what will be the component of observation? What will be the component on hands-on? This is also something you need to look out and check the website, check their official website, make proper inquiries. If any of your seniors or your colleagues have already gone to that institute, make proper inquiries, but do not take it 100% also. Take it with a pinch of salt, because each person's experience and their level of absorption is different from the other. But it helps to make proper inquiries. And if needed, you can also visit the institution in person. So, to conclude, the aim of all academic certification help you acquire a skill set that should be helping you in either practice in clinics or help you instruct in clinics or start a new specialty area or to perform in research or provide any value addition to your hospital or institution that you are employed in. Do not enroll in haste and repent in leisure is what I would tell to all my young friends. So, thank you all. For any queries, I am available at these mail IDs. You can contact me through the organizers, or you can get in touch with me directly. I would be happy to help any of you. Thank you for your patient listening.
So much, Dr. Anuja, for giving the wonderful talk about the certification specifically following optometry program. We do have a question. It may not be pertaining to certification. I feel you will be the one of the correct persons to answer this. One person have asked, can you explain about something on Doctor of Optometry program, the optometry admission test, the OAT exam, OCANS exam at Australia and Philippines. So do you have any thoughts on this, ma'am?
Thank you for your question. Thank you, Dr. Gopinath. So licentiate exams, the candidate is obviously talking about licentiate exams. There are actually preparatory material available also in the market. So I think in this kind of license exams, mostly practice is the key. Just one of the speakers had spoken earlier. You have to take it seriously and do many question papers and practice. I'm not sure, at least in Tamil Nadu region, if any institute is offering such a program for clearing license. In Kerala, I think one or two institutions have started this. And Doctor of Optometry is a different ballgame altogether. First of all, you need to see whether you have the kind of commitment, patience, and perseverance to provide to pursue a doctoral program. So so first of all, you have to be very clear of your area of interest and your research questions. You have to do a lot of spade work. I would say at least 1 to 2 years you have to take. First of all, try and do and find out what are the things you can't do or you wouldn't want to do, and then come to maybe what you want to do, right? And then that makes it easier. With that in mind, the spade work needs to be done. Again, going for the right kind of universities with proper affiliations. I strongly am against online, doing PhD degrees online and or part time. If you have the part time is at least okay, because you can you can't be a full time professional also and then do a full time PhD also. At least you have to have be in regular touch with your guide, pursue your coursework, and have a keen follow-ups will be the key. But if you are doing a PhD, then you should consider 5 to 7 years of your life gone. And no better example than you, Gopi. I think you can answer that question better.
Yeah,
Yeah, thank you so much.
yeah, thank you for being with us, ma'am, patiently, and